Did you know that some common medications can harm your memory and brain? Have you ever wondered if the medications you are taking could be contributing to your cognitive decline? What would happen if you could identify these medications and avoid them, thus improving your quality of life? Recent research has shown that memory loss doesn't just occur with age. Some medications taken without proper guidance can have adverse effects on the mind. How can we protect our mind while treating other illnesses? Studies show that proton pump inhibitors, such as omeprazole and anticholinergic medications used to treat conditions such as Parkinson's disease, increase the risk of developing dementia. Are we aware of the risks of self-medication, which can exacerbate these effects? Stay with us until the end, because the seventh medicine is the most dangerous and almost no one knows about it. We've included all the references used to create this video so you can access them whenever you want. Before we continue with the video, I have something amazing for you. Access the link in the pinned comment right now. Discover a special surprise that can transform your health. Now, let's go straight to the video. For a long time, it was believed that dementia and cognitive decline were inevitable consequences of aging. However, recent research has questioned this view, indicating that memory loss is not a normal part of aging. Dementia and Alzheimer's disease are caused by specific pathological processes in the brain rather than simple aging. Studies indicate that it is possible to maintain capabilities or even improve them as you age, as long as risk factors are better managed. Factors such as a balanced diet, regular physical activity, mental and social stimulation, in addition to controlling chronic diseases such as hypertension and diabetes, are nutrients for brain health. Other lesser-known factors such as alcohol abuse, smoking, and nutritional deficiencies, specializing in vitamin B12, also play a role. Understanding that cognitive decline is unplanned can inspire changes to promote lifelong brain health. Memory loss is influenced by numerous factors, many known, such as aging and neurodegenerative diseases. But there are other less obvious factors that also impact brain health. Excessive alcohol consumption, for example, causes direct damage to the brain, while smoking damages blood vessels, affecting cognitive function. Traumatic injuries, such as racing in contact sports or accidents, can lead to severe and stiff consequences, including chronic traumatic encephalopathy. Cerebrovascular accidents, CVAs, disrupt blood flow to the brain, severely compromising memory. Sleep deprivation and stressful stress increase cortisol levels, a hormone that directly damages the hippocampus, a crucial area for consolidating memories. Furthermore, a deficiency of vitamin B12, essential for neuronal function, can cause alarming neurological symptoms. Psychiatric disorders, such as depression and anxiety, have also significantly impaired the ability to concentrate and retain information, worsening memory lapses. Despite the multiple causes, the good news is that many of these factors can be prevented or managed with simple interventions, such as improving sleeping habits, adopting a balanced diet, reducing the consumption of harmful substances, and treating mental disorders appropriately. Taking care of your brain is a choice that directly reflects on your quality of life. Many common medications have side effects on memory and cognition, something patients often ignore. Although they are effective in treating many conditions, some can have serious cognitive consequences. Below, see how these medications can impact the brain. Number 1. Omeprazole and other proton pump inhibitors, PPIs, such as lansoprazole, pantoprazole, and esomeprazole, are medicines widely used to treat problems such as gastric reflux, gastritis, and stomach ulcers, but few pose the dangers associated with prolonged use. These medications reduce the production of acid in the stomach, providing quick and effective relief from symptoms, but this same mechanism can trigger serious health problems when used for prolonged periods or inconveniently. Studies indicate that continuous use of PPIs is related to a significant increase in the risk of developing dementia and memory loss due to reduced absorption of vitamin B12, an essential nutrient for brain health. Furthermore, these medications can cause changes in the intestinal microbiota, impairing communication between the intestine and the brain and worsening cognitive impacts. Omeprazole, as it is widely sold without a prescription, is often used indiscriminately, often for years, without proper supervision, exposing users to additional risks such as kidney disease, bone fractures, magnesium deficiency, and increased susceptibility to infections. Experts warn that the use of these medications should be restricted to periods of 2 weeks to 3 months, depending on the case, and always associated with lifestyle changes, such as dietary adjustments and reducing factors that trigger reflux. Although they are effective in controlling gastric symptoms, irresponsible use of PPIs can seriously compromise long-term health, especially brain health, reinforcing the importance of careful medical supervision before starting or prolonging treatment. Number 2, anticholinergics, a class of medications widely used to treat conditions such as Parkinson's disease, overactive bladder, and some respiratory disorders, are effective but hide harmful risks to memory and the brain. These medications block acetylcholine, a neurotransmitter essential for cognitive functions such as memory and learning, which can lead to serious cognitive side effects, especially with prolonged use. Studies show that people who regularly use anticholinergics are up to 54% more likely to develop dementia, with the risk increasing proportionally to the dose and duration of use. Medications such as diphenhydramine, scopolamine, oxybutynin, and biperidone are often associated with memory impairment, interfering with communication between neurons and impairing learning processes. Furthermore, these medications can cause other adverse effects such as dry mouth, constipation, blurred vision, and in more serious cases, delirium and mental confusion, especially in the elderly, who are more susceptible to their effects. Although there are newer anticholinergics that do not pose the same cognitive risks, inappropriate or significant use of older options is still common and can significantly contribute to cognitive decline. It is crucial that patients and doctors carefully evaluate the benefits and risks before opting for these medications, seeking safer alternatives or limiting their use to the minimum effective dose and shortest possible duration. Awareness of the dangers of anticholinergics is critical to protecting brain health, especially in environmental settings. Number 3, corticosteroids, widely used to treat allergies, asthma, autoimmune, and inflammatory diseases, are powerful medications that, when used for long periods or in high doses, can cause harmful damage to mental and cognitive health. Substances such as prednisone and dexamethasone alter levels of cortisol, the stress hormone, and can cause structural changes in the brain, especially in the hippocampus, an essential area for memory and learning. Studies show that prolonged use of corticosteroids is related to disorientation, mental confusion, anxiety, depression, and even an increased risk of developing dementia. Even inhaled versions, such as fluticasone and budesonide, present risks when used in high doses. Additionally, these medications are associated with serious problems such as osteoporosis, diabetes, hypertension, and increased vulnerability to infections, making them a significant concern for specific patients. It is essential that the use of corticosteroids is strictly supervised by health professionals, limited to the minimum possible doses and for the shortest possible time. Non-pharmacological strategies and less invasive alternatives should be prioritized whenever possible to minimize risks. Ignoring these dangers can result in a series of long-term health complications, highlighting the importance of monitoring medical care and increasing awareness about the adverse effects of this type of medication. Number 4, Benzodiazepines, widely used to treat insomnia, anxiety, and other disorders, offer quick relief but hide a dark side when used long-term. Medications such as alprazolam, diazepam, and lorazepam are linked to serious cognitive damage, including memory loss, difficulty concentrating, and even an increased risk of developing Alzheimer's. Studies show that prolonged use of these substances can cause structural changes in the brain, impairing communication between neurons and directly affecting memory consolidation. Furthermore, these drugs are notoriously addictive, creating a physical and emotional dependence that makes it difficult for many patients to stop or use, even in the face of obvious side effects such as fatigue, muscle weakness, and disorientation. Another alarming point is that benzodiazepines interfere with the sleep cycle, a crucial step in information processing and memory. Despite its short-term effectiveness, its long-term use is strongly discouraged. To treat insomnia and anxiety, alternatives such as cognitive behavioral therapy, relaxation techniques, or lifestyle changes are recommended, while benzodiazepines should be reserved for emergency cases and in minimal doses. Awareness of the dangers associated with these substances is essential to protect brain health and prevent serious long-term complications. Number 5. Amphetamines and the invisible impact on memory and the brain. Amphetamines are widely used in the treatment of attention deficit hyperactivity disorder, ADHD, due to their ability to temporarily improve concentration and reduce hyperactivity. Medications such as methamphetamine, amphetamine, and their derivatives help many people focus better on daily tasks. But this immediate benefit comes with a number of dangerous side effects, especially when used for prolonged periods or in high doses. Although amphetamines increase levels of neurotransmitters such as dopamine and norepinephrine in the brain, providing a temporary increase in attention and performance, continued use of this type of medication can cause serious bodily harm. Over time, prolonged consumption can lead to memory loss, permanent brain damage, and cognitive decline. This occurs because the chronic increase in dopamine in the brain can alter neuronal connections, impairing the proper functioning of the areas responsible for memory and learning. Additionally, amphetamines are highly addictive, and dependence can develop quickly, leading to a dangerous cycle of continued use. Amphetamine abuse is a growing concern, especially among young people who may be attracted to the drug's stimulant effects without fully understanding the long-term harm it can cause. The negative effects are not limited to memory loss. Problems such as chronic insomnia, irritability, anxiety, depression, and even cardiac arrhythmias and hypertension can arise with excessive use. Even after stopping the use of amphetamines, the indirect damage can be irreversible, affecting the ability to concentrate, retain information, and even logical reasoning. In the long term, the brain may have difficulty recovering, which can result in significant difficulties for those trying to restart their daily activities. Amphetamine abuse can also impair motivation and energy, further impacting cognitive and emotional performance. Due to the serious associated risks, it is essential that amphetamines are prescribed with extreme caution, with constant medical monitoring and always considering safer alternatives such as cognitive behavioral therapy and other non-pharmacological approaches, which do not involve the risk of dependence and permanent damage to the brain. For those who truly trust the treatment, it must be ensured that the medication is used in the lowest effective dose and for a limited time, with strict monitoring to avoid misuse and specific long-term effects. Number 6. Antidepressants and the impact on the brain, a double-edged sword. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, and tricyclic antidepressants, are often prescribed to treat depression, anxiety disorders, and other brain disorders. Humor. While these medications play an important role in improving emotional and psychological well-being, their impact on memory and cognitive function is not as simple as it seems. Serotonin, a neurotransmitter essential for mood control, also plays a critical role in the memorization process and brain function in general. When antidepressants change serotonin levels, it can have unexpected side effects on the brain, including memory problems. Although some patients experience improvements in mood, others may report cognitive difficulties such as memory lapses and difficulties processing new information. This is because, by regulating neurotransmitter levels, antidepressants can also affect areas of the brain involved in learning and memory retention, such as the hippocampus. Long-term use of antidepressants can, in some cases, impair neuroplasticity, the brain's ability to adapt and form new neural connections. Furthermore, side effects are not just limited to memory. Some antidepressants can cause drowsiness, dizziness, difficulty concentrating, and other symptoms that affect a clear mind. In the long term, extended use of these medications can result in a paradoxical effect, where instead of improving cognitive function, the patient may face a gradual reduction in the ability to maintain and analyze information. Although most patients do not suffer from serious cognitive deficits, it is important that antidepressants are used judiciously, with ongoing medical monitoring and constant assessment of benefits and risks. In many cases, it is possible to manage the symptoms of depression and anxiety without resorting to medication, or at least complement treatment with alternative approaches such as cognitive behavioral therapy, physical exercise, and relaxation techniques, which do not carry the risks associated with depression. Prolonged use of antidepressants. For those receiving medication, it is essential that treatment is personalized, tailored to individual need, and monitored regularly to minimize adverse effects on brain health and overall well-being. Number 7. Benzodiazepines and long-term effects on the brain, a silent trap. Benzodiazepines, such as diazepam, lorazepam, and alprazolam, are often prescribed to treat conditions such as anxiety, insomnia, and panic disorders. These medications are effective in offering quick, temporary rest, but their prolonged use can have serious consequences for brain health, especially with regard to memory and cognition. Benzodiazepines act on the central nervous system, enhancing the effects of a neurotransmitter called GABA, which has calming properties. While this helps reduce anxiety and promote relaxation, it can also affect several cognitive functions, including short and long-term memory. Using these medications can impair the brain's ability to form new memories, resulting in memory lapses, confusion, and difficulty maintaining focus. Studies indicate that continuous administration of benzodiazepines can even lead to changes in the structure of the brain, particularly in areas critical for memory, such as the hippocampus. Furthermore, prolonged use can increase the risk of dependence and withdrawal syndrome, making it even more difficult to stop treatment without adequate medical advice. In the long term, excessive use of benzodiazepines can affect neuroplasticity, the brain's ability to create new connections and adapt to new experiences. This can result in a cognitive numbing effect, where the person not only loses the ability to remember, but also to learn new information. Given the potential for harm, healthcare professionals generally recommend that benzodiazepine use be limited to short periods, with the implementation of therapeutic alternatives such as cognitive behavioral therapies, relaxation techniques, and non-addictive medications. Awareness of the risks of prolonged use of benzodiazepines is crucial to avoid irreversible physical damage and preserve mental health in the long term. Number 8. Antipsychotics. Medications to control psychiatric symptoms. Antipsychotics, used to treat conditions such as schizophrenia, bipolar disorders, and other psychiatric disorders, are known for their sedative effects and for helping to control hallucinations and delusions. However, long-term use of these medications can have a significant impact on memory and cognitive functions. Studies have shown that patients using antipsychotics, especially second-generation antipsychotics such as clozapine and olanzapine, are at a greater risk of cognitive decline and memory difficulties. This is because these medications can affect areas of the brain responsible for memory and learning processes, interfering with the signaling of essential neurotransmitters such as dopamine and serotonin. In the long term, this can result in permanent cognitive deficits, making it difficult to reason, concentrate, and form new memories. Furthermore, antipsychotics can cause side effects such as excessive sedation, weight gain, and metabolic changes that can further worsen the patient's mental and physical health. Therefore, it is crucial that the use of these medications is closely monitored by healthcare professionals, and that less harmful alternatives, such as psychological therapies or psychotherapy, are considered whenever possible. In conclusion, long-term medication use, although often effective in treating a variety of conditions, can have serious consequences for brain health, directly impacting memory and cognition. Medications such as proton pump inhibitors, benzodiazepines, and antidepressants, among others, can, over time, disrupt essential mental abilities, such as the ability to remember, learn, and process information. Therefore, it is essential that patients are aware of the risks associated with these treatments and always seek medical advice to ensure that their use is appropriate and not excessive. Therapeutic alternatives, such as lifestyle changes, cognitive therapies, and, when necessary, adjustments to medication treatment, may be essential to preserve brain health and quality of life. Prevention, constant monitoring, and the search for less invasive solutions are essential to protect mental health in the long term and avoid irreversible damage to memory and other cognitive functions.